Today we will be performing a Mona Lisa Touch treatment, and this is a revolutionary new treatment to address vaginal atrophy in women of menopausal age, but also in women who suffer from menopause at an earlier age, either due to a medical reason or after having surgical treatment or other treatments such as for cancer. What is vaginal atrophy? It's quite a common condition, especially in women of menopausal age. About half or 50% of women will experience symptoms related to this. So with menopause, we often know the common symptoms like hot flushes, night sweats, aches and pains and similar, but often there are conditions that women suffer from who we may not potentially feel more comfortable discussing, and these happen in the most intimate regions of a lady and can include things like dryness in this area, burning, itching, sometimes irritation and feeling like you're having a discharge that may be uncomfortable, sometimes recurrent urinary infections and painful intercourse, and that can impact on other areas of a lady's life as well. So with this new treatment, the aim is that we're hoping to regenerate and make that area of a female healthy again, and to address the symptoms that can impact on a lady. Why does vaginal atrophy happen? Mainly because the estrogen levels, which is a lady's female hormones, tends to drop, and these can be for many different reasons. Mostly for a natural reason, such as menopause. So whereas we get a little bit older, the ovaries stop producing estrogen and therefore the levels decrease in the vaginal region. In younger women, sometimes you may have treatments such as breast cancer, ovarian cancer, or in some cases, some women have a genetic predisposition to these certain cancers, and they may have surgery to help prevent these cancers from occurring down the track. So the idea of this revolutionary treatment, the upsides are it's a nice quick procedure. It takes about 15-20 minutes to do. It's minimally invasive and there is no downtime whatsoever, and a lady is safe to have it, go home straight after or off back to work and drive home quite safely. The laser itself, it's called a Smart Side Deca, which is a very special laser which is set for resurfacing and reshaping that vaginal region of a lady. So the beauty about this laser is the way that the pulsing comes out of the laser. So it's very gentle, it causes no side effects to that area, and like we said, it's a quick treatment which can be safely done, which we do in the Academy Day Hospital here as well. What a lady requires to do before she sees us is come in and have a consultation. So we sit down and have a nice chat about the symptoms that are bothering a lady and the appropriateness for treatment as well. Often we will also recommend that a lady has a pap smear done at least within the last 2 years of having the procedure, and to make sure that your pap smear is normal and there are no concerns. So on the day of treatment we come in, we recommend that the vaginal area is nice and clean and dry. So if you can, if you're on other medications or creams, please don't use them on the day. But you'll meet our friendly staff here. We will go through and discuss the procedure again with yourself and a consent, and you will also meet our nursing staff who will guide you and give you support during the procedure. The procedure itself is nice and quick and easy, and most women say it's very comfortable and there's minimal discomfort involved. We do the procedure in 2 stages. So the first stage is what I call the preparation stage, and that's where we prepare the vagina to make it ready and more responsive to the laser treatment. So we will use a cotton swab to dry out the internal region of your vagina, and following this we insert the laser probe and we will perform the treatment then. So I'll show you the laser probe. So as you can see, it's quite a small device here, and it's nice and thin, it's smooth, and it does insert quite comfortably into the vagina during the procedure. The special things about it are this tip area here, and we call it a special pyramid mirror, which basically means that we can treat the whole channel of the vagina very quickly and easily, causing minimal discomfort to the patient itself. Most ladies will say they feel a little bit of vibration, maybe a little bit of warmth during the procedure itself, but no pain whatsoever as we insert the probe and perform the procedure itself. After the procedure, we just recommend that you perhaps abstain from intercourse for up to 5 days, but other than that, there's no real other concerns or side effects that we worry about. So today is Gina's 3rd treatment with the Mona Lisa Touch. And how's it been going, Gina?
Oh, it's been fine.
Yeah?
It's been fine.
Yeah, so Gina had a few issues with dryness mainly, a little bit of incontinence, but mainly was the issue with painful intercourse, wasn't it, Gina?
Yes.
Yeah, and how have you felt?
Tract infection.
Yeah, and so far so good? It's been getting better? Yeah.
Right.
Any concerns with your previous procedure, anything you weren't happy with?
No, it's been very comfortable, and you girls make it very easy.
Fantastic. So the first part, as you remember, Gina, is we have to prepare the area of the vagina just to dry out the tissues inside, just to make it a little bit more happy for the laser to be present as well. Just going to touch you now, okay? All right, and here we go with the cotton bud swab. And you just let me know at any stage if you're uncomfortable. So we're just slowly going a little bit in deeper up the vaginal canal, just to dry out the tissue along, as you know. Still okay? So relaxed, you look like you're going to float off.
Literally ready to go to sleep.
Yeah. We'll gently insert the probe slowly, and then, as you recall, a little bit of vibration sensation, maybe feeling a little bit warm. As we come out closer to the outside, maybe it's a little bit more sensitive, but I will warn you before then as well. We're just going to gently come through. The preparation bit, that's the one that takes that little bit of time, and then the procedure itself, just a few minutes. I think we might need to pull the sheet up a bit if that's okay.
Sorry.
We'll go up to 3 for the stacks. Fantastic. Yeah, so as we talked about, Gina, we can change the settings, and because you've done really well, we're just going to try and put it up to 3 stacks, which will be good, really. What we do, Gina, during the treatment is we slowly pull the probe back little by little. And we just rotate the probe just slightly, just so that we can cover and treat all areas of the vagina. We're just slowly drawing out and giving you the laser treatment as we do that. Did you feel that one? No? All right? Yeah? Still okay? Now the last one. This is the one you might feel a little bit zappy, okay? Ready? 1, 2, 3. How's that?
Yep.
Not bad? Can do another one? Beautiful. And that's it. Well done, Gina. Superstar. Yeah?
Yeah.
Oh, fantastic. Okie dokes. All right.
Quick and easy.
So that's it for the procedure itself. So as we talked about before, we just recommend don't do anything sort of out of the ordinary, but you are welcome to just head straight back home, back to work, whatever you need to do. Probably just avoid intercourse for the first 5 days. But other than that, no other real issues that we expect you to have. Yeah, have you got any questions, concerns?
No, same as always.
Right. Fantastic. Yeah, no dramas though.